Welcome. You're listening to the Sickle Cell Action Network, a weekly internet radio show presented by Martin Center Sickle Cell Initiative and sponsored by Mass Therapeutics. We're coming to you live from Indianapolis, Indiana, and we're here to serve you by providing up-to-date information and opinion on all matters pertaining to sickle cell disease. My name is Gary A. Gibson, and I am your host for the next 2 hours. Let me start by saying that I don't have sickle cell disease, nor do I carry the sickle cell trait. In spite of that, I am no stranger to sickle cell. Quite the contrary. You see, even though I don't have sickle cell, it has had a very huge impact on my life. That's true because its complications took my wife from me after 12 years of marriage. It also caused her to have a miscarriage that resulted in the loss of our twin babies that she was carrying while in a sickle cell crisis. So all told, sickle cell has taken 3 lives from me, and I feel the pain of those losses every single day. I currently serve as the president and CEO of Martin Center Sickle Cell Initiative, a community-based organization that has been serving people with sickle cell for over 45 years. Each day I attempt to transform the pain of my losses into positive energy that is focused on making a difference for those who are battling sickle cell. From being involved with sickle cell for over 40 years, I'm able to say that much progress has been made, but there is still so much work to do. This show is an opportunity to contribute to the ever-expanding dialogue about sickle cell that is taking place all around the world. Our show is about raising awareness, but it is also about so much more. I like to say that sickle cell awareness is important, but we need more than awareness. Those living with sickle cell are already aware. That makes me ask, so what are we doing for them? My answer is not enough. That's why we've named this show the Sickle Cell Action Network, because awareness without action has very little impact. We want this show to be a source of information and a call to action to help those who must live with sickle cell in their midst. We have designed this show to provide information that is beneficial to patients, caregivers, family members, and friends alike. Most importantly, we want people with sickle cell to know and understand that they are not alone. The Sickle Cell Action Network show features live guests who are healthcare providers, patients, advocates, and others who are engaged in the fight to eradicate sickle cell and ease its burden on those it affects. Today, we're pleased to speak with 2 dynamic sickle cell warriors who know about traveling with sickle cell. We're honored to have Sharon Hatcher-Hutchinson and Jamie Fox in studio with us today to talk to us about this important topic. We are serious about sharing valuable information, and we hope that you will join us every week, same time, same station. If you've missed some of our previous editions or wish that you could listen to them again, don't worry. Just go to the Martin Center Sickle Cell Initiative YouTube page, and you'll find them there. Now let's get on with our show, and we'll start with this week's edition of Sickle Cell News Update. And for that, we have about 3 little articles that we want to share with you today. The first one I think is important for a lot of people who have sickle cell disease and who undergo transfusions. So the headline on this particular article is Iron Overload Therapy in Sickle Cell Patients Related to Poor Quality of Life, Clinical Effectiveness Study Finds. And the article says, iron overload, a major concern in patients with sickle cell anemia, can lead to serious tissue damage in the skin and other important organs. We all know that. Researchers at Mercer University investigated the clinical effectiveness of iron chelation therapy and its effect on the quality of life and satisfaction of sickle cell patients, and found that treatment regimens and side effects of this therapy explain patients' poor compliance to treatment. The research paper, called Quality of Life, Clinical Effectiveness, and Satisfaction in Patients with Beta Thalassemia Major and Sickle Cell Anemia Receiving Deferacirax Chelation Therapy, was published in the Journal of Basic and Clinical Pharmacy. Iron overload is a serious side effect of beta thalassemia major and sickle cell anemia and can lead to iron accumulation and deposition in the liver, heart, skin, and other organs, potentially leading to serious tissue damages. The conventional treatment of these inherited forms of anemia are frequent blood transfusions and iron chelation therapy for iron overload. Iron chelation therapy can be performed effectively through the oral administration of Deferacirax, or DFX, one of the possible pharmaceutical solutions, and there are others out there. However, patients present poor compliance to DFX due to side effects, which include abdominal pain, nausea, vomiting, and changes in renal and liver function, as well as the additional cost associated with the iron chelation therapy. In this observational study, researchers evaluated the quality of life, clinical effectiveness, and satisfaction in pediatric and adult patients receiving DFX chelation therapy to better understand the impact of such therapies. The study included 37 pediatric and 35 adult patients who were being treated with DFX for at least 6 months. The results showed that despite long-term treatment for iron overload, the DFX-treated pediatric and adult patients are not achieving their target hematological marker thresholds, mainly serum ferritin levels. DFX appeared to not be effective in reducing serum ferritin levels. Importantly, the chelation therapy appeared to negatively affect the patient's health-related quality of life, which probably explains the poor compliance to the therapy. Researchers concluded that healthcare providers should be aware of the importance of monitoring iron overload with timely initiation of DFX chelation therapy and ongoing adjustments to chelation regimens and or transfusion methods to decrease hospitalizations and improve compliance to iron chelation therapy of the patients. So that's an interesting thing that people need to keep their eye on, because again, many sickle cell patients do have to undergo transfusions on a regular basis, and there are potentially some issues, at least with this particular medication, the DFX. Our next story comes from Angola, and this one is titled 10,000 Born with Sickle Cell Disease. And the article comes from Luanda in Angola, and it starts by saying at least 10,000 children are born with sickle cell disease every year in Angola. The information was released Thursday in Luanda by the National Director for Public Health, Miguel de Oliveira. According to Oliveira, sickle cell disease causes pain, suffering, reduces life expectancy, and causes a great impact on the family, society, and economy. Oliveira was speaking at the opening of the Angola-Brazil seminar on attention to people with sickle cell anemia. He stressed that the prevalence of the disease in the country is still to be determined with precision, but it is believed to affect a larger number of people. Oliveira said early diagnosis and proper care are crucial to reduce morbidity, death, and secure better living for the sick. According to him, the disease requires the involvement of the family, community, and professionals in various health specialties to lessen the complications. Oliveira stated that the Sickle Cell Anemia Initiative, which is a pilot project designed to produce methodologies and contribute to reduce morbidity and mortality, was launched in 2011 with the help of the Texas Children's Hospital and the Baylor College of Medicine. Oliveira said as well, more than 1,250 health professionals among physicians, nurses, midwives, laboratory technicians, and others have been trained under the project. They are attempting apparently to deal with sickle cell in Angola, and we obviously wish them well. Our last story for today also comes from the African continent, and this is from Uganda, and the headline says, Buganda Kingdom joins government to fight sickle cell. And this comes to us from Kampala in Uganda. Buganda Kingdom yesterday renewed their partnership with the Ministry of Health to promote primary health care with focus on sickle cell disease. Speaking after a closed-door meeting with Buganda Kingdom, Health Minister and other officials yesterday, Health Minister Dr. Jane Aching said that they had renewed their partnership with the Kingdom on spreading information on health issues affecting the public. Dr. Aching said the ministry had been working with Buganda Kingdom on several health promotion areas, including immunization, prevention of HIV/AIDS, environmental hygiene and sanitation, and prevention of teenage pregnancy, among others. She, however, said the renewed partnership will focus on preventing sickle cell. I am glad to announce that the Kingdom is committed to promoting this agenda in all their celebrations, starting with the annual Kabaka Run, Dr. Aching said. She added that they will be passing out messages on the disease through the media, encouraging people to screen and find out their status. Some people think the disease is caused by witchcraft, and this is an opportunity to give them correct information, she observed. And that's it for that story, and there might have been a couple of people that raised their eyebrows when I said that some people attribute it to witchcraft, and that is true. Other research that I've done indicates that people in the tribal societies in India, as well as Africa, view sickle cell as something that is a spell. We know better than that, and we certainly hope that one day they will too. So that is it for the sickle cell news update, and we are about to take a break, and when we do, we will return with the lovely Jamie Fox and Sharon Hatcher Hutchinson, who will talk to us about traveling with sickle cell. This is the Sickle Cell Action Network show. I'm Gary A. Gibson, your host. Welcome back to the Sickle Cell Action Network. We're glad that you're with us here on this Tuesday, August 23rd, and our topic today is traveling with sickle cell. And I think it's an important topic because, as we were talking during the break, people need to get on with their lives, and we want people to enjoy their lives as much as they can. And so, with that in mind, I would like to welcome Sharon Hatcher Hutchinson and Jamie Fox. They actually are both returning guests, and we're glad that they felt comfortable enough to come back and visit with us. And even though you've been on before, there are perhaps people that are listening that did not hear you when you were on before. So I want to ask both of you to tell us a little bit about yourself as we get started. Where were you born? How old are you? And what type of sickle cell do you have? Sharon, let's start with you.
Okay, good evening, Gary, and
Hi.
thank you for welcoming me back to the show.
Always a pleasure.
All right. Well, my name is Sharon Hatcher Hutchinson, and I was born in a little small town called Opelika, Alabama. So I'm partially a Southern girl. I've lived here most of my life, but
Okay.
I still have a lot of Southern ways. And
At least you got rid of that accent, or at least some of it anyway.
yes, I did.
Yeah.
I did. And I basically, I'm 54 years old, or 54 years young, I should say.
There you go.
And I have dealt with sickle cell for a long time. I have SS disease, and it hasn't been an easy road, but it's been a learning experience for me.
Okay.
So,
And Jamie, what about you? Tell us about yourself.
My name's Jamie Fox, and I was actually born in Louisiana.
Two Southern girls.
Yeah, in New Orleans, but I didn't stay very long, and I've been here since I was like 10, so it's like home to me. But I am 34 years old,
Okay.
or young, should I
Yes,
say young too?
yes,
Yeah.
yeah.
And I have sickle beta thal, which is
Okay.
sickle beta thalassemia disease.
Okay.
So
Do you still have family down in Louisiana, or
a
or
little
not?
bit,
Okay.
just a couple aunts.
Hopefully none of them are affected by all that flooding.
No, they're not actually.
Good,
Yeah.
good. Well, our topic today, like I said, is traveling with sickle cell, and I'll start by saying that there is very little published research about the risk faced by travelers with sickle cell disease, and that's one of the reasons we're focusing on this topic today. Have either of you, or Sharon, let me start with you, have you ever seen any written information about this topic?
that I have not. I have looked and done some research, but I haven't found anything that was written on that particular topic about sickle cell and traveling. No.
Okay, and Jamie,
Yeah,
what about
neither,
you?
Neither have I.
Okay, neither of you. So I'll tell you that I did find a couple of things, but it's like 2 or 3 pieces,
Minuscule.
very minuscule,
Yeah.
and
Okay.
2 of the 3 are actually the result of work done by Tosin Ola, who is the founder of Sickle Cell Warriors, and she has 2 different posts that she's written about sickle cell and traveling, and I actually made a copy of one of those from one of her earlier blog posts, and I have it here somewhere that I can share with both of you. But there really isn't much on the subject, and that's that's another reason why we have to do this, is to try to help people gather enough information so they can make decisions about what they do when they want to travel. So let me start also by saying that sickle cell patients have so many extra precautions to take when it comes to doing just about anything, and traveling is no exception. That's especially true when it comes to flying, and we'll talk about flying in a little while, but first, let me ask you both this question. How did you first work up the nerve to travel anywhere at all? Sharon?
Well, I just think that I've never been afraid to try anything, and I've always been kind of a free spirit a little bit. So Traveling for me, just wanting to experience, other parts of life, other parts of the world, or not the world, but other parts of the United States. I just said, hey, I'm going to do it because I want to live, and I'm not going to just stay in a shell.
Right.
I want to live my life. I want to see things, and I want to be as normal in my normal as possible. So that was probably the reason why I decided to go ahead and travel.
And Jamie, what about you?
Same with me. I don't even. I think it's bad, but I don't even try to, put this scenario in with the sickle cell. Like, clearly I think about it and I worry, but that worry doesn't hinder where I want to go or what I want to see. So I think that the worry component is similar to Sharon, that I don't really worry about that. If it were to happen, obviously, then I just put myself in that situation, but I try not to worry about it.
Okay. And so there's a common theme here, which is try not to worry about it and live your life.
Yeah,
I'm picking that up from both of you,
Absolutely.
right?
Yeah.
Okay, so I wonder, flying is one thing, and taking car trips can be kind of a difficult thing too. So I want to talk about that. And before we actually started the show, Jamie told me that she does a lot of traveling, more so by car than by plane. So let me go to you, Jamie, and say, you remember your first long car trip that you ever took, and if you were a kid when that happened, do you remember whether your parents made any special preparations, and if so, what were they? Do you have any recollections like that?
I traveled now as an adult way more than a child.
Okay.
But the longest road trip I can remember is actually going to Disney World when I was a kid.
Okay.
And, that's a really long drive.
Yes, it is.
But, I don't really recollect my mom doing anything extra.
Okay.
I'm sure she had her information for me, if I were to, need to go to the hospital or whatever, but I don't think she really put the worry in me, to worry about it as we're traveling, because that can set you into a crisis right then. Just the worry.
Right.
Absolutely.
Right.
So I don't really remember her, we need to do this, and this, so you don't get sick, and we don't want you to get sick. She just didn't do that.
Okay.
So
Okay.
I don't really.
By the way, when you were younger, did you have a lot of issues? Did you get sick a lot?
I did.
Okay.
I did. It really started for me around the age of 16 when I started my menstrual.
Okay.
And so losing the blood was I was in the hospital weekly.
Wow.
Not weekly, sorry, monthly.
Monthly, okay.
Yeah, monthly for when
Still,
I got the.
wow.
Yeah.
Still.
And so I literally graduated high school by the skin of my teeth, because I missed so much school. I was in summer school every summer, and so it was tough as a in high school, but
Okay.
younger than that, not so bad.
Not so bad?
Mm-mm.
Okay, and Sharon, what about you and that long car trip? Do you remember taking your first long car trip?
I remember as a kid, we didn't do a lot of traveling, but I know once or twice a year we would go visit my grandparents in Alabama, and
Okay.
so that car trip
That's a pretty long
Yeah.
trip,
that's
too.
a pretty long
Yeah.
drive. As far as really anything special that my parents did back then, I think the only thing that I can remember is even in the summertime, my mom making sure that I had sweat clothes in the car, blankets, those type of things. I know we carried jugs of water
Everywhere.
and so those were really the main things that I remember.
Okay.
That my parents did extra
Okay.
for me.
Okay.
And having pain medicine, my mom always carried that with
Yeah.
her in her purse. So I don't remember a whole lot of extra things. As a kid, I was just like my brothers. We jump in the
Right.
car and everybody's excited about the trip.
Right.
So nothing, special.
And then, as the same question I asked Jamie, as a child, did you have more issues or not?
I did.
Okay.
I had more issues. I was hospitalized a lot more than normal. I remember plenty of times being out of school, I've said this in a previous show. I remember having an intercom system in my hospital room that went to my homeroom at school. And so I was able to talk with my homeroom teacher.
Really?
Because I was in the hospital for approximately, I think at that time, about 6 months.
Wow.
So having an intercom system so I could,
Talk back
participate
and forth.
with the
Yeah.
class and be able to get homework. I remember my mom and dad bringing homework
To the
back and
hospital.
forth to the hospital. And, so that was one of the things. I didn't get to graduate with my high school class, but I ended up going back.
Okay.
And I ended up getting a GED, but I
Mhm.
also ended up going back to college.
Okay.
So that was, wonderful for me.
Awesome.
So,
So now that you are adults and you're taking trips in cars these days, what do you do to minimize any issues that, to prevent any issues? And do you hydrate before you leave? Do you stop and every now and then and walk around and stretch yourself? Or what kind of things do you do, Jamie?
I think definitely hydrate is, first and foremost. Even to be conscious of it like the week prior,
Right.
To leaving, is kind of a routine for me that I try to, get a lot of fluids in the week before we go, and then, during, obviously, but I don't know. I don't think that I have a lot of water. I just stop. Like if we stop for gas or whatever, then I'll make sure that I have get a big jug of water then, like each time
Right.
we stop. But I don't carry a 12-pack of water or anything like that. I just kind of, because as it sounds to we should drink and we should drink and we should drink, it's really hard to drink a lot.
Yeah, it is, it
and
is.
so when you're in the hospital and you get the fluids, you just get the fluids. You don't have to
Right.
drink
Right,
the fluids.
right.
And so it can be difficult to drink extreme amounts.
Gallons and gallons,
Yeah, just because you're going out of town or whatever. So I think I'm still pretty normal, and I just try to hydrate the week prior.
Okay.
Yeah.
And Sharon, do you take any special precautions?
well, just a little bit contrary to what you do. And it may be because I have 20 years on you.
Yeah,
So maybe
yeah.
in 20 years you'll
I'll
think
be
about this a
different,
little differently. But when I travel in a car, I do carry my case of water.
Do you?
Yes, I
Okay.
have at least a
Like a
24 pack
yeah.
of water.
24-pack, okay.
And I've done that for a long time. And I make sure I hydrate during the week prior.
Yeah.
One of the other things that I do is I usually check with my hematologist to make sure my blood levels are fine.
Like
make
before
sure
you
my
go?
hemoglobin
Before
count.
you
Yeah.
go? Okay.
Anytime I travel, whether
Okay.
it's by car or by
Fine.
air,
Mhm.
I always make sure that my blood levels are, fine.
Yeah.
They're in a good area because I don't want to get where I'm going and then end up in a crisis. Because even driving long trips, you can get there
Right.
and you're exhausted.
Right.
I mean, and so those are the things that I try to make sure that, I check
Make
with
sure,
the doctors
yeah.
prior
Yeah.
to me leaving.
Well,
that-
if you either one of you, if you're going to take a trip that's 6 hours or more, I mean, don't you plan on stopping several times just to get up and stretch?
I
No,
was-
I'm bad.
You don't.
You don't do that?
I'll stop maybe 2 to 3 hours.
Okay.
Into
Yeah.
the trip, I'll stop.
Uh-huh.
If nothing but, take a quick restroom break.
Mhm.
I don't stay off the road a long time.
Okay.
But just enough for me to make sure I've got, a fresh bottle of water, and take a bathroom break.
Okay.
And I'll do that,
Okay.
just for maybe the 6-hour trip.
Mm-hmm.
In the car, if it's longer than 6 hours, then yes, I'll probably
Okay.
take a little bit more. I'll, maybe go an hour and a half to 2 hour. I'll stop
Mm-hmm.
and take quick bathroom breaks like that.
Okay. Well, okay, we're going to take a break now, but we're off to a good start. And thanks to Sharon Hatcher Hutchinson and Jamie Fox for being our guests today and talking with us about their experience. And as we get deeper into this, we'll try to share some more tips with you. This is the Sickle Cell Action Network show. I'm Gary A. Gibson, your host.
Bast Therapeutics is leading the way in developing treatments for sickle cell disease. We're proud to sponsor the Martin Center Sickle Cell Initiative in its mission to provide leadership, education, and support services to the sickle cell community.
Hi, I'm Gary A. Gibson, your host for the Sickle Cell Action Network Internet Radio Show. If you are impacted by sickle cell disease in any way, whether you are a patient, a caregiver, or a friend, you need to join me every Tuesday at 4 p.m. Eastern Time. I promise that you will find our show to be full of information, perspective, and opinion about all things sickle cell. See you Tuesday right here on RadioNext.tv, the Cool Groove site. Welcome back to the Sickle Cell Action Network show, and I'm happy that we have two wonderful guests today, Sharon Hatcher-Hutchinson and Jamie Fox. And actually, we're going to take a little bit of a side here. We were talking during the break. We got on the topic of hydroxyurea, and this is an important topic too, and I thought it might be beneficial for us to revisit some of what was said during the break. And Jamie, you really have a strong testimonial about the effectiveness of hydroxyurea. And from what you just said, you've been taking it now for about 15 years, and you've recently come off of it so that you can work on your family. That's a good way to say it, isn't
Yes.
it? Yeah, very politically correct.
Yes.
And you're saying that you can tell a difference.
Yeah.
Tell us a little bit about that.
Yeah, I was just talking about basically the quality of my life at the present time, and I think the difference, well, clearly the difference is the hydroxyurea, because I've been on hydroxyurea for so long, like you said, 15 years, and I only get off of it when I try to expand my family.
There you go.
So now that I've been doing that for about 4 months now, I can tell the complete difference of my quality of just life in general. And I think it's just so beneficial for people to know that the amount of difference that hydroxyurea gives you on your quality of life, because it's kind of night and day for me. I've already been hospitalized about 3 times, and prior to these back-to-back hospitalizations, I was not hospitalized for about 1.5 years, which is phenomenal for me.
Right.
And so I just think that, or I know that being on the hydroxyurea, the only time I would not be on it is when I'm trying to expand my family, because when I'm on it, I feel so much better. And I just can't imagine trying to live my life without it. I cannot.
One of the most, I think, important things that you said was that from the time you were, before you took hydroxyurea, you maybe hospitalized 100 times.
Yeah, so like from age 16 to about 19, I was literally hospitalized over 100 times in those 3 years. So it was a tough high school year. It was tough high school years for me. And to get through that disease and without hydroxyurea. So by 19, hydroxyurea kind of came about, and they introduced it to me since I was an adult, and so I had transferred over from, the pediatrics to the adult hematology, and I just think that it changed my life. Hydroxyurea changed the quality of my life, and I don't know where I would be right now if I was not taking it, like when I'm not trying to expand.
Right, and Sharon, you're nodding your head in agreement too, so you agree with what she's saying.
I absolutely agree. I think that with me, just right now, not being on the hydroxyurea because of the other medications that I'm having to take, I see a huge difference. I've had more blood transfusions than I would normally have. I may have 1 or 2 blood transfusions in a year, and just since March of this year, I've had 6. I've had 6 blood transfusions.
Yeah.
So I'm tired all the time. I noticed that now, instead of being able to get up at 7 o'clock in the morning. Now I'm lingering to 8:30, 9 o'clock in the morning, you know, because of the lack of energy.
Yes.
And I'm definitely having to rely more on taking my B supplements, you know, than anything, just to give me that extra energy to make it through that day. So, yes, I totally agree that the hydroxyurea has
It's a
definitely,
game changer.
yes,
Yeah.
it has definitely made a great impact on my quality of life.
Yeah.
And so without it, I definitely see the difference. And I you know, I don't like the fact that people don't know enough about taking hydroxyurea. I think that more of the sickle cell community should, if you're investing in your quality of life, I think that you should be taking hydroxyurea.
At least try it.
At least try it,
Right.
and don't
For
give
6
up
months
on
at
it
least,
for you know.
yeah.
Don't give up on it in the beginning because you think
Don't
that it's
feel
not
it,
working,
yeah.
or this is how we're supposed to feel, or I've always felt like this. Don't
You have
give
to
up
give it
on it right
time.
there. Give it time. Give it time.
And Sharon, there was one other thing you said during the break that I thought was important that people should hear, and it was like, you know, you feel like this is how I'm supposed to feel, so why bother?
Right.
So
And
what did you say? You said something like
Well,
that.
a lot of times, for people that have never taken hydroxyurea, this is what we think that we're supposed to feel like all the time.
Right.
We're supposed to be tired. We're
And have pain.
And have pain, you know, consistently.
Right.
This is just the way that you think you're supposed to feel. But once you take it, and I mean take it religiously, and stay on it, you'll start to see the change and feel that, hey, wow, there
It
is
didn't have
something
to
out
be that
there.
way.
It doesn't
Yeah.
have
All
to be
that
that way.
time.
Yeah, and you
Yeah.
look back and you're like, wow, I spent all of those years without it, and I could have felt this way. You know,
Right.
I could have felt better. I could have
Right.
spent less time in the hospital. I could have had less blood transfusions. I could have done more in my day.
Or traveled
Or
more.
traveled more.
Yeah.
Yeah. So I mean, these are things that, you know, add quality to your life.
Right, right.
It adds quality.
Well, I
to
said
your
at the
life,
beginning
so.
of this little sidetrack that this was a detour, but in reality, it maybe isn't. I mean, it's like you can do all kinds of things to ensure that you have every opportunity to travel. And one of those things that you
Absolutely.
might be able to do, and this is a
Yes.
good tie-in, right?
Yes.
One of those things that you might be able to do is be on hydroxyurea so that you feel better, you feel stronger, you have fewer pain issues, etc.
Right.
So I did bring it back. And,
Yes,
and
you
thank you
did.
for sharing that.
That's
But
good.
you were both so powerful in your testimony that I thought it would be beneficial for our listeners to hear that. You know, on the issue of travel, though, and we'll get there and say, because of the unique travel needs and the medical complications of patients with sickle cell, it is important for travelers to know where they can access medical care at their place of destination. And one of the things that is recommended, that I definitely would recommend, and I'm going to ask you, do you research the medical facilities there, wherever you're going, before you go?
Well, one of the things that I do is I talk with my hematologist a lot,
There you go.
and they know when I'm traveling. So what I usually do is try and get a referral from them.
There you go.
If they don't have a referral, then you can always go online and find the hospitals that are in that area. I give them a call sometimes, and you'd be surprised the information that they'll give you over the phone. I'll let them know that I'm traveling to their city, I'm going to be there X amount of time, and I have sickle cell disease. What are their protocols, you know, if I were to get sick? How do they handle sickle cell in the emergency rooms? And these are things that I find out from that exact hospital. I don't have to go and visit them once I get there, hopefully.
Right.
You know,
You don't want
but
to,
at
yeah.
least I know that information up front.
Oh, wow. Okay.
So that's one of the things that I, you know, would want to encourage people is that when you are taking those trips, that's why I said talking with your hematologist
Yeah.
is so crucial. You need to have that rapport with them because things like this is very important. Being able to get there and know, you know where the hospitals are located.
Right.
A lot of times they can say, oh yeah, we know about, we've had patients that have visited this particular hospital. And so you can, be able to go to that hospital. Or they may know a physician that has a clinic that may be in that city, and it's
Sure.
not far away from where you are. And so, a lot of times if they know that you're visiting there, they might call that physician for you and say, hey, I have a patient that might be in your area during this time. Would it be okay if they pay you a visit if they need to? So, I mean, those are things that, I try to do.
Good. Jamie, you're shaking your head as if maybe you don't do that.
Right.
Okay.
Mine's a little different. Not that I don't do it, but I definitely like to know where a hospital is,
Okay.
like when I'm traveling. And that's just kind of like by default,
Right.
like getting off the highway and like, oh, there's an H. There's a hospital sign.
Right. Okay.
Like one is close,
Right.
But at the same time, I travel to Virginia a lot.
Okay.
And so I've had a couple hospitalizations there, unfortunately, but they treated me very well, and that was only with the knowledge of my mom kind of looking up like where I should go.
Okay.
My mom has been my advocate, since I was a child, obviously, and she's also a nurse, and so she found a certain hospital for me there,
Okay.
and I have been there, I think maybe only twice,
Okay.
but yeah, so I kind of like ask her help, I think is more of
Okay.
like my route.
Okay.
That's good.
Yeah, but it's it's only happened a few times, but the times that it has happened, she's kind of helped me and told me where to go.
Okay, well, I do think that that's good information, and particularly sharing what you said, working with your hematologist and getting a referral ahead of time is possibly the very best thing you could do. And then secondly, calling the hospital yourself and talking to them and tell them that you're going to be in their town and you might have to come see them. You hope you don't, but you might have to, and, please take care of you when I do.
Right. It's better to be prepared than not.
Yes,
The
absolutely.
other thing, real quick, that I heard just the other day when I was at my committee meeting for Sickle Cell is that a lady has a travel letter from her
Okay.
hematologist.
Right.
Right.
And so clearly I know, like, I could communicate with my hematologist and tell them, like, I'm going out of town, where should I go, blah, blah, blah. But I thought a letter would be so beneficial too. Just something, something that has like a stamp of like my doctors, my
Absolutely.
hematologist,
Right.
their
Absolutely.
phone numbers. I try to give, people when I'm at a different state, the phone numbers, and if they just look at me like I'm crazy, so maybe like a letter
Right.
would
And
be
you said you have one.
I do. I have
Yeah.
one,
Do
and
you?
it states that, it states my name and that
All
I
your
have
info,
sickle cell
yeah.
disease. And as we get further into it, there are some other things that I carry with me
Yeah.
when I travel.
Yeah.
So
Okay.
other credentials that I have,
Okay.
and those are important things. But yes, carrying a letter,
Yeah.
especially on their letterhead,
yes.
is even
Yeah, and that's what she said.
more powerful.
I'm just
Yeah,
like,
so
why
this
didn't I
kinda
ever know about
validates.
Well, now you do, right?
unfortunately.
Now you do, and so do the people that are listening. This is
Right.
something that can help. So we're going to take a break here, and when we come back, we'll continue this discussion about traveling with sickle cell. This is the Sickle Cell Action Network show. I'm Gary A. Gibson, your host. Welcome back to the Sickle Cell Action Network show, and we are talking about traveling with sickle cell today. And we've covered a lot of territory so far. We've still got some more to cover, and I'm going to go back to Sharon now and say, Sharon, have you ever gotten sick while you were traveling out of town by car? And if so, tell us about that trip and what happened.
Well, I traveled. I drove from Arizona to Indianapolis,
Oh my!
And
how
you
many
drove.
hours is
and I
that?
drove.
Okay.
That's actually 24 hours if you drive straight.
Right.
It took me 2 days
Yeah.
to get here.
Yeah.
On the first day I started out, I drove literally 12 hours, and after the 12 hours, I started feeling
Terrible.
really bad. Yeah, like I might have been going into a crisis. And so at that point, I had to pull over, and I was near Albuquerque, New Mexico. And I remember there was a hospital there, and I went straight to the hospital. I didn't even stop at the hotel first. I went to the hospital and told them what I had, that I had SS disease. And so they were a little familiar with it, but they immediately gave me oxygen and ran fluids. I was there probably, I'd say maybe 2 hours, and I felt better. So after that, I just left there and I went over to, they told me of a good hotel to go stay at, and I stayed at the hotel the rest of the night.
Okay.
And so from there, I was able to start out again the next day. And
Was that
and
uneventful
travel.
then? The rest of the trip was uneventful?
The rest of the trip was uneventful.
Okay.
Yes, I was pretty good the rest of the trip. But the main thing I think was just because I was drinking a lot of fluids on my trip and eating a lot of fruits and not eating heavy, so that way I kept my energy level up.
So in Albuquerque, they sort of knew what to do with you.
They sort of knew what to do with me. They
Okay.
wasn't, 100% sure, but they had some encounters with patients with sickle cell. So they knew a little bit. They knew about the fluids, and they knew about the oxygen. And they asked me what type of pain medications, and I told them. But the good thing is that I was able to take ibuprofen 800, and then with the fluids and with the
Okay.
oxygen, I was able to get through that. So I
Okay.
didn't have to encounter any of the other narcotics.
Okay. Jamie, what
Opioids.
about you? Have you had a issue while you were traveling by car, and if so, what happened?
Yes. So the one, I've had a few actually, but I'll just go with the one where I had a good experience, because the other one is a whole nother show. But like I said, I traveled to Virginia back and forth, and I don't know what it is about Virginia. I don't want to say it's the elevation with the mountains, but I kind of want to say that.
Could be.
Because I don't feel like I'm, like I'm not in Alaska.
You're not in the Rockies, but still.
Yeah. And so, anyway, sometimes I just don't feel very well when I get there. And so, we traveled, I made it there. I think even a couple days in, like, I was totally fine. But then, like, on the third day, I started to have pain. So, I have all my stuff with me, right? So I wrap my leg, I take the meds, and I rest, actually, even though I want to be, like, out with my family. They go, and, my husband takes the girls somewhere and does something with them so I can get some rest. Well, the pain, I think it was just too far gone, and so I tried to hang tight with it like overnight, and it didn't work. So the next morning, or it was actually the afternoon, he took me to VCU, which is in Virginia, and literally, like, he dropped me off. I don't like my daughters to come to the hospital, so even when I'm at home, like, I either get dropped off or he takes me and drops me off, and that's it. But he dropped me off and took the girls to a movie, right? So I can handle my own. I feel like wherever I'm at, because it's my disease, I know my body the best. And so I get there, they get me like right in. I give them, my info and let them know what I have. And the ER doctor was just phenomenal. Like, I had a really good response. I told her what I take. I told her who my hematologist is, would she like to call them. She did nothing of the sort. She listened to what I said, and she got me exactly what I had. And like you said, like, I was in and out within 2 to 3 hours.
Right.
Okay.
They went to the movie, came back, and
Okay.
I'm
And you
ready
were
to go.
fine.
Yeah.
I think that's a great story.
And not like fine, but my pain was gone.
Right.
And so
Right.
I did keep it easy the rest of the trip, but I was good to go. Like, my pain didn't come back or anything. So
Okay. Well, I think there's something in here, too, about pacing yourself when you're traveling, because the tendency is to go do as much and everything that you
Right.
want to, everything that's there, everything that you
No.
went to do.
Yes.
And maybe you should pace yourself,
Yes.
right? And it sounds like maybe that time maybe you didn't.
I know,
Yeah.
for sure. I think vacation in general just gets ahead of us.
Yeah, it does.
Even normal, healthy people.
Right.
It just gets ahead of you, and you can crash.
Yeah.
And I crashed and burned.
Yeah.
But I got it back together, and it was good to go. So.
Okay, ladies, let's shift our focus now to air travel.
Okay.
And we all know there's a lot of people who don't have sickle cell who are afraid to fly. I see people like that all the time.
Yeah.
but you do have sickle cell and you're not afraid of flying. Knowing that there is an increased risk of health complications when flying, why aren't you afraid to, Sharon?
Well, like I said
Is this
before,
like the answer before?
right? I'm sort of a free spirit, and then also I rely a lot on my faith,
Yes.
Okay.
and so I believe that if it's for me, it's for me.
Mm-hmm.
And if it's my time, then
Yes,
it's my time.
yes.
So I'm gonna live my life,
Mhm.
and even with the risk, I'm not a bungee jumper or anything like that.
Right, right.
I'm not gonna jump off a
Yeah,
cliff with a rubber
building,
band or anything
yeah.
like that. But I am gonna travel. I would like to see different places. I like talking with people, and if the Lord allows me to do that,
Right.
then that's what I'm going to do. And I just believe that He will take care of me,
As you
along
get
my
there.
steps.
Yeah,
That's right.
exactly.
So,
And Jamie, what about you?
I think this, very similar. I'm not going to not. No, clearly I'm not going to bungee jump.
right, right.
I'm not gonna.
Neither one of you. Me either.
Right. I mean, I would fly anywhere. My husband actually did fly to China last year.
Okay.
And that's a long
Oh,
flight.
yeah.
It is.
And I think somewhere like that, I mean, I would really have to do some changing some things,
Right.
during
Absolutely.
but a normal flight, I mean, I would fly, wherever, but I think 8 hours plus is kind of a game changer with the flight, because that's a long time in the air for just a normal person. And then with us, I just think it's a game changer the longer the flight, but yeah, I'm gonna go wherever I want to go to.
So let's ask, where have you flown to, Sharon? Some of the places you've been.
I've flown to, I've been to Texas, I've been to Houston, I've gone to Arizona, I flew to Atlanta. So I've had very short trips, I've had very long trips. And those are some of the places that I've flown to.
Okay, what about you, Jamie?
I've flown to Dallas.
Oh, Baltimore.
Baltimore, yeah.
Yeah, Dallas, Connecticut, Jamaica.
Ooh, that's
New
an
York.
interesting one.
Absolutely.
Okay. Flying to Jamaica. This is a little bit different because you're going out, you're going abroad now, and you're
Yeah.
going out of the country. And you're going to a place that maybe doesn't have the same
Adequate.
standards
Yeah.
of healthcare that you're accustomed to. What was that like?
Oh,
Where did you go in Jamaica?
Gary, I was young.
Okay.
No,
there's a good-
not like a baby young, but
yeah.
like young and
Yeah,
like you couldn't tell me nothing.
Yeah, I know
right?
I knew exactly what you meant.
Okay.
Yeah, I knew exactly what you meant.
But and my parents flew down first. This is where my dad's from.
Okay.
So we flew to Montego Bay,
Okay.
and I flew maybe like a day later. So I think that was, well, I don't have to worry about anything. My parents are there,
Okay.
and my dad is from there.
Okay.
So if anything were to happen,
You're covered, yeah.
I'm probably covered a little bit, and obviously I had my meds and stuff, but I was probably like 23 or so. So, I mean, I wasn't worried about nothing, even though it was abroad, and I have sickle cell. Like, I just didn't worry about it.
Cool. All right, so any number of factors associated with travel, including dehydration, infection, altitude, weather changes, any of these things can sometimes cause an acute pain crisis for some people. Still, there is a lot still in your control. So I think what I'd like you to do, both of you, is talk about some of the steps that you take to minimize the impact of any of these factors that you might face as a sickle cell patient when traveling. Sharon.
Okay. Well, just to let you know, I jotted down a few things on that.
Yes. And we want to hear them.
The first thing I do is I usually make a checklist. So these are things that I do. I write down before when I know that I'm going to travel, so that the week prior I can just about have everything done in that checklist and give myself a couple of extra days to relax afterwards. Because even when you're preparing to travel, that's strenuous and stressful.
It's a lot of work.
So you want, and you want to have as much of that done prior, and you want to allow yourself enough time to come down off of that adrenaline before you even travel. So I allow myself a couple of days prior to that to just rest.
Yeah.
Even down to packing. I pre-pack. I make sure I'm packed at least 2 days in advance, so that way those other 2 days, if I do I forgot the toothbrush.
Yes.
Then you can just throw it in the bag, or I forgot this, that sort of thing. One of the biggest things that I do, like I said, is I discuss my plans with my hematologist. So I try to make sure that I allow them enough time to, if my hemoglobin levels are too low, that they have plenty of time to hydrate me.
Sure.
If I need a blood transfusion, I've got a few days on board, so that way I don't get a blood transfusion today and jet out tomorrow.
Yeah.
Because I'd like to see whether or not my blood counts are up enough for me to travel before I actually travel. So I do those things. I make sure I pack all my medications. I take all, and once again, when I was talking about those credentials, I like to make sure that I have my medication list with me. These are things that I put in my carry-on. Your medication list, your medicines, the physician's phone numbers and names, your allergies, those type of things. Always carry those. Anything that you get from your physician. I have asthma, so a lot of times I have to have oxygen. And so having the paperwork that states that I may have to have oxygen, those are things that I make sure I always carry. Carrying narcotics, definitely.
Yeah.
I have paperwork that says, yes, I do have to take morphine, because of this. So that is documented. It's also on letterhead. It's usually on a prescription pad. Okay. And they give you that, and they sign off on that until that way. That's part of the credentials that I carry.
Okay.
So those are things that I always make sure and get plenty of rest before I leave, of course.
Yeah.
I remember it was about a year ago that we went to Baltimore. You went to the Sickle Cell Disease Association of America convention, and you showed me your bag. You showed me all of that stuff, and it's impressive. And I actually was sort of the reason why we're talking about this today is I thought that was really important information to share. So thank you for that, Jamie. What about you? Do you do any extra steps to minimize the impact of these factors? Anything that we haven't talked about already?
No, pretty similar. I mean, I'm probably even worse with the packing. Like, I try to pack like 2 weeks in advance.
Really? When I travel, I pack the day before. I guess that's a luxury.
I have a problem. So, and I'm packing 2 other people, and so I just try to, like you said, like every day I try to put a couple things in, and then within a week I'm packed, and then I have a whole nother week to rest, and so because I feel like the stress of that, can like make you go into a crisis. So I think that's probably the main thing that I do also.
Okay. So we're going to take another break, and then when we come back, we'll continue the discussion about traveling with sickle cell. This is the Sickle Cell Action Network Show, and I'm Gary A. Gibson, your host. Hey, welcome back to the Sickle Cell Action Network Show, and we're talking about traveling with sickle cell today. And we're speaking with Sharon Hatcher Hutchinson and Ms. Jamie Fox. Both been very delightful today and open and honest, and we appreciate that. So back to the discussion. Sharon, flying in pressurized aircraft usually poses no problems for sickle cell patients, but some related issues have occurred from time to time. Have you ever encountered any problems that you think might have resulted from cabin pressurization? And if so, could you explain why you say that?
I have experienced low anxiety and maybe loss of oxygen along with that anxiety. So, and I think that's one of the things that can, occur.
What was the source of the anxiety? Just because you feel the pressurization?
Just because maybe? I feel the pressurization going from ground into the air, and I think that alone, I also have asthma.
Right, okay.
And so feeling that type of pressure on the chest when
It's
you're
gonna bring me that.
had just kind of thrown me into having that anxiety.
Okay.
having
And
that low
Jamie, have you
oxygen.
ever had a problem like that?
I haven't really had a problem like that. I flew, like I said, last year to Dallas, and it was fine. Flight there and back,
Okay.
I had no issue at all.
Okay. Some say that the best things to do when flying are to dress warmly, drink plenty of fluids, and to move about the cabin as often as possible. Sharon, do you do these things, and do you do anything else in addition to these things while you're up in the air for a couple of hours or more?
Well, one of the things that I do prior to getting on the plane is I now know that going to the doctor and talking with my hematologist and getting an anti-anxiety medicine, which helps relax me, is good for me.
Okay.
So I don't feel the loss of oxygen. And also, while I'm in the air, I do. I drink plenty. I get up. Not a lot to disturb the people around me, but I do get up and stretch. And walk back to the bathroom and back, just to keep your limbs moving and keep that blood flowing.
Yeah.
So those are a couple of the things.
That was
I
one of
do.
the things that I saw on Tosin Ola's blog when she was talking about flying, and she definitely recommends that you get up every now and then and walk around to keep your blood moving.
The first time I flew, I didn't do that, and I could definitely tell the difference when I got off the plane.
Okay.
So
Okay.
yeah.
And then, so Jamie, what about you? Do you dress warmly?
That's the main thing I do. I dress really warm. Even if I'm going to like a tropical spot, I still try to, have layers on and keep layers on and have a blanket or whatever. And but I don't really get up and move around. I just try to, kind of sit a certain way and move my legs and stuff that way. But just as long as I stay warm, I feel like I'm good to go.
I guess I kind of think about it too, because I know on a few flights that I've taken, like recently out to California, and you're up there for 4 hours. Fortunately, I was able to get a direct flight, which those things seem to be fewer and fewer available.
Right.
But
Yeah.
anyway, I'm on a long distance flight, and if I didn't change my position, my leg would start to go to sleep. So I'm thinking, okay, well, maybe a sickle cell patient might have to deal with this if they don't get up and move around.
Absolutely.
Okay, so also, some sickle cell patients have suggested that you make the airlines aware that you have sickle cell and that you may have special needs. Do you do that before you fly, Sharon?
I have done it in the past when I was taking, when I had oxygen regularly. I would let them know, ahead of time that I may have to have an oxygen carry-on.
Okay.
And so they know that, and they, explain to you exactly what type of containers that you need for your oxygen. And once they're aware of that, they do make the accommodations for you.
Right, that's kind of what I
So,
thought. And what about you, Jamie?
No, I've never.
You never told them that
I've
you
never
have sickle
told
cell?
them.
Okay.
Good to know for maybe
Future.
the future, but I've never said anything about it.
Have either of you, by the way, ever had to use wheelchairs or anything to get to the gate and stuff like that?
I have not, but I wish I have.
Yeah, talk about that.
I remember, where was I even? I feel like it was Texas, but it wasn't Dallas. It was maybe Houston. And that airport
It's
is
huge.
like the biggest airport I've ever seen in my entire life. And literally, I was on one end and had to go to the next end, right?
Yep.
And there's this tram thing that
Yep.
you can,
Yep.
Yeah.
Well, nope, didn't get on that.
You just walk
And I
instead.
was like, oh, that's what that's for. After I got all the way down. And I'm like, my legs hurt so bad. Like my hips hurt so bad because it literally, I felt like it was 3 miles.
Right.
It was ridiculous.
I know exactly what you're talking about because I
Yes.
transferred through Houston when I came back from Los Angeles a couple weeks ago, and I
was
got on the tram though.
bad. Oh, see?
Yeah, I got on the tram. So another suggestion for traveling sickle cell patients is to reduce the flight durations by scheduling flights with layovers. And Actually, like I said, there's sometimes seems to be fewer and fewer direct flights anyway, but
Right. It's like not even an option.
it's not even an option. You have to have these layovers,
Yeah.
but definitely that makes sense to give yourself a little bit of time in between flights. Do you try to do that when you're booking your flights, either one of you?
No, honestly, like I try to get there directly.
You try to get there directly. Okay.
Which has happened, like years ago. I can't remember the last time I had a direct flight though, but I tried to when I'm booking it to do a direct flight, but most of the time there is at least one layover. Which is fine. I feel like it's good to be able to switch planes and, well, not when you have to sprint from one side to the next, but
Right.
but it's good to be able to get out and walk around and have some food and get some drinks. And
Right.
so I just think that, even though it's far and few between, it still works out when there's a layover.
Right.
So.
Yeah, I mean, it gives you a chance to a little bit more leisurely maybe grab
Right.
something to eat or go to the bathroom
Yeah.
or whatever and stretch your legs. So we're got a few more things we want to talk about when it comes to traveling with sickle cell when we return on the other side of this break. This is the Sickle Cell Action Network show. I'm Gary E. Gibson here. Early. Welcome back to the Sickle Cell Action Network show. I'm Gary A. Gibson, your host, and we are speaking with Ms. Jamie Fox and Ms. Sharon Hatcher Hutchinson. We are talking about travel. Before we return to that topic, we want to ensure that we let you know a little bit about our sponsor. The Sickle Cell Action Network show is sponsored by Mass Therapeutics, a publicly traded biopharmaceutical company headquartered in San Diego, California. Mast is currently leveraging the molecular adhesion and sealant technology platform derived from over 2 decades of clinical, non-clinical, and manufacturing experience with purified and non-purified polaximers. Mast has developed a drug called MST-188 as a candidate for serious or life-threatening diseases with significant unmet needs. Among those needs is the treatment of sickle cell disease. Mast has enrolled sickle cell patients in a clinical trial known as EPIC. EPIC stands for Evaluation of Purified Polaximer in Crisis. If successful, EPIC could result in the first treatment of its kind to treat sickle cell disease patients while they are in crisis. The EPIC study aims to determine whether MST-188 can shorten the duration of a painful crisis. MST-188 is an investigational drug that has not been approved for commercial sale in any jurisdiction for any use. MST-188 potentially improves oxygen delivery, and it may help keep blood vessels from becoming blocked and more obstructed. It may improve blood flow by stopping cells from grouping together. It may also reduce inflammation, and it may restore cell membranes and give damaged cells time to heal. EPIC participants continue to receive their normal pain treatments during crisis, and their participation is free of charge to them. The patients involved in the EPIC study may not only be helping themselves, but they might also be helping future generations of those yet to be born. If you are interested in learning more about the EPIC study, please visit www.theepicstudy.com. And we definitely thank Mass Therapeutics for their sponsorship of the Sickle Cell Action Network show. And we also want to ensure that people are aware that they will be having their annual conference in New York City on September 8th. And yours truly, Gary Gibson, will have the opportunity to be there. And I'm looking forward to seeing our friends from Mass Therapeutics and participating in their one-day conference there in New York. That's September 7th. Actually, September 8th is the day of the conference, and we wish them well. Back to our topic. One of those last things that I wanted to ask you ladies about is dealing with the TSA could possibly be a problem when you're walking in with carry-on bags full of narcotics or whatever else is in there that looks like some sort of paraphernalia. And I do believe that I've heard more than one story of issues like that, so I wanted to kind of just touch base on that. So that's really an issue because most prepared patients will have some meds and other health aids in their carry-on bags. Sharon, have you ever encountered any difficulties at the TSA checkpoints? And if so, how did that go? And I do believe you told me about an issue like that recently. Or in relative time.
I've had a few issues with carrying medications on board. One of the times that I can remember is taking medications in the bag, in my carry-on bag, but not having them in a clear container. So something that they can see. And carrying, when you have an opioid or a narcotic like morphine aboard, those are things that they really get, really touchy and scared about.
Right, that's
so,
why I'm asking this question.
This is those are one of the things that you want to make sure you have some type of credential showing that you do take that. Because even though you can say I have sickle cell anemia, it doesn't really it doesn't register to them of all the things that you may have to take.
Right.
All the medications that you need to have. So having that,
So does that letter from your doctor, is that what it is, or do you have something else that you're carrying that shows, you have a right to carry this?
I have something else that I have the letter from the doctor.
Okay.
But another thing, too, is making sure that the medications that you take are in their correct containers.
Right.
One of the things that I made the mistake of is I carry Excedrin, and I carry those in my purse. But from time to time, I will put an extra few ibuprofen 800 in that bottle. And, of course, those pills are a lot bigger than the Excedrin. And so when that goes through the scanner and the bottle, says Excedrin, they'll ask you to take it out if they see, something that kind of looks a little different. And I've taken out my Excedrin bottle, and it'll have Excedrin on the bottle. But then when I pour them out, I've got those extra big 800 ibuprofens. And so they're like, what is that? And I'm like, well, that's just ibuprofen 800. But then, how do you prove that that's ibuprofen 800? So even down to over-the-counter medications, just make sure that they are in the original, bottles, and which is an inconvenience sometimes, because a lot of times you get when you get ibuprofen 800 from the pharmacy, if you're like me, I get the big bottles. The doctor writes a script for the big bottles, and you don't want to always you don't want to carry this huge bottle with you.
Right.
So having an older bottle with not the date, but just another bottle that's smaller that actually has ibuprofen on it, and having the ibuprofens put in those. You might want to tell your doctors to write your script with a lower amount, just so that you can have that to carry when traveling. But yeah, they will give you a headache about traveling and you don't have medications in the correct bottles. Morphine, I use liquid morphine. A lot of people do the pills, the capsules, or tablets. I do liquid. And so with my liquid morphine, I use a syringe. So those are things that they're looking at too. You've got a syringe. It doesn't have a needle in it, but it's a syringe. So on the label on my morphine, it says take 5 mils of morphine every so many hours. So they can see that, and they see that this is a 5 milligram syringe. So
What do you put that in?
I stick that in the same bag with the medications. But
when you take the morphine.
How do you take it?
Oh, how do you take it? The cap on the bottle has a little hole for the opening,
syringe.
the syringe portion, and you just pop it in, and then you turn your bottle upside down.
Do you drink it?
You just drink it.
Okay.
But usually, I drink it, and then I, drink water or juice or something afterwards. Yeah, because it's very bitter.
Yeah.
But it works a lot faster.
Oh, for sure.
So that was one of the reasons why I take it that way.
Gotcha.
And I don't have to take it very often. Usually when I get to morphine, I'm pretty much
done.
Yeah. I know that that's my next step to the ER.
Yeah.
But I carry it. I always carry it.
Yeah, just because in case
Just
you get to that point.
Yes, that's one of those things that we just have to do is be prepared.
Right.
And Jamie, what about you? Do you have...
I've never had a problem with TSA or anything, and part of the reason of that is I don't take my meds in my carry-on.
Okay.
I put them in my luggage. I'll just have like Aleve or ibuprofen in my purse or whatever, and it's in the correct container or whatever, and so that I never have a problem with that. And usually, I've prepared myself, so I don't feel like my flight, like I'm going to have to take something so quickly, even though it could happen, right? But it's never happened. I just feel like I prepared myself well enough, to get to my destination and not like have to take a medicine. So that's why I usually put my pills in the luggage, just so I don't even have to worry about it.
Okay.
And I'm glad you said that because that was going to be my question. Is I know you prepare yourself for that, so that way you don't, that doesn't happen.
Right.
But there can be that one freak time that it does happen, and that's what I think that's the reason why I do carry mine in a carry-on, just because of that one particular time that it may happen.
Right.
Then I don't, from the time that they would have to go through and find my luggage underneath the plane,
Right.
just to get to my meds, is crucial. That's just like when we walk into the ER, from the time we get there to the time they get us
The
to
medicine,
the bag,
yeah.
that time is crucial.
Yeah.
So that is not actually a fear, but it's just I want to be prepared just in case that does happen, so that way I can say, well, hey, in my carry-on, right here in this bag, is my medications.
Yeah.
And so everything is right there, and inside that carry-on is a clear bag that has all of the
of it,
medications along with all of the credentials to go
Yeah.
along with it.
That's probably age too, Gary.
I think
Experience, right? It's experience.
Yes.
Experience
That's
can help
experience.
a lot. Experience can help a lot, particularly when you pay attention to it. Right? All right. Well, I think what I'd like to do is just ask, are there any other tips for traveling that we haven't covered yet? I mean, we want to be sure that people do get a chance to travel and enjoy life as best they can. So you want to make sure that you travel safely, that you travel well. Any other
Smart.
tips? Travel smart, yeah. Any other tips that we haven't covered that either one of you think we could do or should talk about?
I think we've covered a lot. Just to reiterate, just make sure that a couple of the most important things you can do is to make sure that you get plenty of rest and plenty of fluids and prior to traveling, and always make sure that you talk with your hematologist. I know that seems like such a minute piece of information, but really is very crucial. Talking with them, you can get a lot of tips on, like you said, safe traveling. And if your body is not up to traveling, don't try and just say, oh well, I can make it there, and
I'll be
take it,
fine.
I'll be fine.
Yeah.
Listen to your body. If you, I don't care if you're just traveling a short distance, a couple of hours away. If your body is giving you any inkling that you're not well, or you're feeling like you're not your 100%, because everybody's 100% is not the same.
Right.
But if you're not your 100%, then just make sure that you discuss that with your hematologist. Make sure that they know that you're traveling, and that they can help you get prepared for your travel. I just feel that those are a couple of the most important things.
I think one thing we haven't talked about too that might be beneficial is, particularly if you're flying, is maybe you want to buy the trip insurance, right? Just in case.
Oh.
Have you encountered a situation where you had a flight and you couldn't make it?
I have had a chance where I was leaving Indianapolis going back to Arizona, and the morning of my flight was at 6:30, and I was in the emergency room at St. Vincent's at 6 o'clock being admitted. So yeah, I have had that problem, and I didn't have insurance.
Right.
But the only good thing is that I called them immediately, explained the situation, and they had me fax over paperwork from my doctor's office that I was indeed admitted in St. Vincent's Hospital, and they did give me
So they honored that.
They honored that.
Okay.
Now, that doesn't happen all the time.
No.
Right.
That absolutely does not happen all the time. I think I just got a very good representative at the time.
Right.
And So it is definitely very important that you take advantage of getting that insurance.
Mm-hmm.
True, it seems like it may, and I understand that finances can play a big
Right.
role
Right.
in whether or not we buy that insurance, because it has for me.
Mm-hmm.
But after having that experience,
Right.
then I try and make sure that I do have that type of insurance on board
Right.
when I fly, because anything at any moment can happen. I didn't expect for that to happen that morning. I felt good the night before, I was all
Right.
ready to go back home, and then at 6 o'clock in the morning, on my way, I go right into a sickle cell crisis. So, instead of going to the airport, I have to make a detour to St. Vincent's, and now I'm here another 2 weeks
Mm-hmm.
because I'm in crisis. So, yeah, it's very important now.
Jamie, did you have anything else you'd like to add?
I think the only thing I would add is definitely if you're traveling alone, flight or driving, that someone should know, right?
Right.
Like
Good
whether,
point.
whether it be your significant other, your mother, or somebody should know you're traveling, and somebody should know when you're coming back. Just so all your info is out there, and I think it's good. Even though most of the time I travel with my husband, there are times when I don't, like for business or whatever. So I feel like when I'm not with him, even though he knows all my info of like what I'm allergic to and this and that, like I always talk to whoever I'm traveling with to let them know
Well, that's
that.
a good thing
just,
too, yes.
Yeah, just in case, something were to happen, because they'd probably be the one taking me to the hospital.
Right.
So I'm really, I communicate pretty well about it, when I'm not in my realm of, care.
Uh-huh.
And
Right.
because everyone in my realm of care knows. But when I'm not, I try to be really communicative
Okay.
so people know.
Okay. Sharon, I saw you make a note. Was there something else you wanted to add?
No, I'm glad she brought that up about the info, and making sure that other people do have your
Yeah,
information.
yeah.
Because you're right, when you're traveling alone, and say something happens and you're not able to communicate to them, if you have an emergency contact list, at least that person can say, hey, this is her physician.
Right.
This is the number. This is the medication she takes. This is what she is allergic to. Those type of things are important
Right.
for when we can't speak for ourselves. So, and I believe that the cards
Yeah.
now that that we're going to have is going to have a lot of that information on there. So
It'll be
when we
very
can't speak for
beneficial.
ourselves,
Yeah.
those cards are very beneficial. And our emergency contact information, am I correct, is on there?
Yes, it is. Yes.
So that way, if the hospitals or anything have any questions, they can always contact those people, and that information they can give them.
What Sharon is referring to is the Martin Center Sickle Cell Initiative is about to start issuing identification cards for those that are its client members who we know have sickle cell disease, and the card is going to be issued to them, and it's going to contain all of the valuable information that we just talked about, and it makes it easy for the patient to share that with the health care providers that they're seeing, whether it's their normal health care provider or someone that they've never seen before. And we are about to start issuing those in the very, very near future. Okay, well, thank you, Sharon Hatcher Hutchinson, for being our guest, and Jamie, thank you for being here.
are welcome.
Both of you,
You're
again did a
welcome.
wonderful job, and we appreciate you taking the time out of your schedules to come to be here with us today and to share information, and also thank both of you for advocating as you do for sickle cell. We need more people like you, and we're very happy that you're here with us in Indianapolis, and thank you for being on our show today. I'd like to leave you something to think about, and I'll start with a quote that I think is actually appropriate for today's conversation. And the quote goes like this: I tend to think you're fearless when you recognize why you should be afraid of things but do them anyway. And guess who said that? Christian Bale. Christian Bale is an English actor. He starred in both blockbuster films and smaller projects from independent producers and art houses. He is known for going to great lengths to portray characters in films, and is most known for his starring roles in 3 Batman movies. Today's show has been about traveling with sickle cell. In some respects, I guess you can say that sickle cell patients who travel are demonstrating fearlessness. After all, traveling to any place other than the comfort of home represents a certain amount of daring for those who know that they can become seriously ill without warning. But that's just one of the many things that makes sickle cell patients the warriors that they are. They are able to stand up to, confront, and overcome some of the limits that most of the rest of us would try to avoid. Many sickle cell patients have been advised not to travel long distances, and many more of them have been advised to stay away from flying at high altitudes. Even with that, a certain number of them go forward and take their trips just like anyone else. People who don't have sickle cell disease can plan to fly across the continent with no hesitation because they don't have to worry about having a pain crisis at 35,000 feet 30 minutes after departure. Sickle cell patients do have to think about that, and it takes a good deal of courage to walk down that ramp and board their plane. This courage is fearlessness in action. According to dictionary.com, the word fearless is an adjective that means without fear, bold or brave, intrepid. We have to be careful when reading that definition, though. Without fear doesn't necessarily mean that there is no fear at all. What it means is that someone who is fearless does have fears, but instead of being stopped by those fears, will move forward in spite of them. In the case of someone living with sickle cell, we know that there are many reasons for them to have fear. Fear of pain, fear of other health complications, fear of medical bills, fear of misunderstanding, and the list of fears goes on. Believe me, I know that sickle cell patients have fears. Everybody does. But sickle cell patients still come across as fearless to me. They come across as fearless because most of them have chosen to move on with their lives. They have chosen not to let sickle cell dictate who they are and what they can and cannot do. To most of us, this makes them seem brave. To them, they are merely living life the best way they can. They are overcoming obstacles that would stop most people, and they are doing it with boldness. And I, for one, think that's great. I have met many sickle cell patients whom I would describe as fearless. It is an honor to know each and every one of them. Their fearlessness inspires me just as it does so many others. Seeing their fearlessness in action on a daily basis is a powerful thing, and it makes me say once again that sickle cell warriors are truly amazing. I feel blessed to know them, and I believe that their presence on this earth enriches it in ways that cannot be duplicated by any other community of people that we have among us. As Christian Bale said, "You're fearless when you recognize why you should be scared of things, but do them anyway." Certainly, sickle cell patients do recognize why they should be afraid of things, but guess what? They go ahead and do them anyway. And that, my friends, is truly being fearless. That's our show for today. Please join us again next week. Same time, same station.